Good evening, everybody. My name is Dr. Narayana Murthy. I'm an interventional cardiologist working with Sagar Hospitals DSI, Kumaraswamy Layout, Banishankari, Bangalore. Today, I would be speaking about the understanding of heart attack. On the World Heart Day, the objective of our talk today is to understand about the heart attack and its causes and preventive measures which can avoid the heart attack. Knowing this will help us to take the right steps towards strengthening of the heart health, which is one of the most important point. Nowadays, the incidences of the heart attack and the number of deaths due to it are consistently increasing in India. Thus, let us understand what is heart attack and what can be the reason behind it. So the heart is the most essential organ and its non-functioning is crucial. Non-stop functioning is crucial for survival. It functions as a pump and allows the circulation of the blood throughout the body. Any interruption of the blood and oxygen supply to the heart because of the blockages in the blood vessels for even a few seconds can impair its function and lead to the heart failure and heart attack. The main reason behind such incidences is increased blood pressure, excess cholesterol, and fat deposition in the blood vessels. Persistent high blood pressure damages the blood vessels by making them more rigid and by damaging their inner walls. This increases the risk of the cholesterol or the fat deposition within the blood vessels. When the excessive fat gets deposited in the inner wall of the blood vessels, it blocks the blood flow. To increase the demand and the lower supply of the oxygen due to the blockages ultimately lead to the failure of the heart function. So heart attack may cause multiple symptoms, which can be different from each person. A person may have just one or a combination of symptoms. This can feel like numbness, squeezing, fullness, and pain in your chest. This discomfort can spread your arms, neck, jaw, and back. However, it is not the only symptom. Possible symptoms of the heart attack can be even dizziness and fainting, lightheadedness, nausea, indigestion, vomiting sensation, and vomiting and shortness of breath. One can reduce their risk by making positive changes to your lifestyle. Here are some of the changes that you can make that can cut your risk and put you on the path of the healthier life. So eating a healthy, heart healthy diet, that's very important. The heart healthy diet emphasizes on increased intake of the fruits, vegetables, the whole grains, poultry, fish, and nuts, while curbing the sugary foods and beverages. Eat more fruits, vegetables, whole grains, and other high fiber food like other plants or plant-based foods containing the substances that may help prevent the cardiovascular disease. So eating more fruits and vegetables may help you to cut back on your high fiber diet, such as meat, cheese, and snack foods. So foods higher in the saturated fat can contribute to a high cholesterol and reduce the blood flow and increase the risk of the heart attack. Hence, it's important to start a healthy, heart healthy diet to reduce the risk. Limited foods high in the saturated fat, which comes from the animal products like the cheese, the fatty meat, and the dairy desserts, tropical oil, and high processed foods. Choose an unsaturated fat which do not raise the cholesterol levels. One can find the unsaturated fat in the foods like nuts, fish, the vegetable oil, olive oil, and sunflower oil. So cut back on your salt intake. This is especially important for those people who are at risk for already who are hypertensives or high blood pressure patients, and try to limit how much sodium you eat every day to less than 2,300 milligrams per day. If this is maintained, this can help lower not only your blood pressure, you can also have prevent the consequences of it. If you have a high blood pressure and limit your sodium to 1,500 milligrams a day, you can lower the blood pressure even more. Choose and prepare the food with little or less salt. Watch for the hidden sodium in your food. That's very, very important. And following an exercise plan and maintaining an ideal body weight is very, very important. Regular physical activity makes the heart you stronger. Regular exercises can help you burn your calories, lower your blood pressure, reducing the bad cholesterol, the LDL cholesterol, and boosting your HDL cholesterol. The good cholesterol is very, very important. And aerobic exercises are recommended for the good heart health, and running and jogging and biking are some of the examples which can keep your heart in a fit state. Stop and get immediate medical help if it is necessary. If you have pain or pressure in your chest, it's very important, especially in the upper part of the body and the chest. Uh, break up down into a cold sweat and troubled breathing, like uh, shortness of breath. It's very, very important. And if you have any joint problems, please choose a low impact activity like swimming or walking. One can aim to get 1 to 2 hours of, or at least a minimum of 30 minutes of moderate aerobic activity per week, like brisk walking, or 1 hour to 15 minutes of high intensity exercises such as jogging per week. That is more than enough. So quitting smoking and limiting alcohol intake is very, very important. Quitting smoking and drinking too much of uh, alcohol can raise the smoking can raise the blood pressure and also cardiac events. So it also adds extra calories, which may cause the weight gain. Cigarette smoking also raises the blood pressure and puts your heart at a higher risk for the heart attacks. Reducing these factors can help uh, to reduce the further complications. Another thing which is more important is managing the stress. In fact, managing the stress levels and getting adequate sleep is very, very important, and also possibly the best way to prevent the heart problems. So overall, it is possible to make heart healthy and prevent the heart failure and the heart attack through lifestyle modifications, lifestyle interventions, and dietary modifications, and by exercising regularly, by taking action to lower the blood pressure, one can help protect themselves against the heart attack. Thank you very much.